so you can let everybody know. Please make sure you update your Zoom name to reflect your organization. That'd be really helpful. And if you're just joining us or hadn't yet put in what favorite concert you've been to, that would be really wonderful. I just went to Dave Matthews right before COVID, but you know, everyone, my kids are like, "Oh, Mom, you're so old, how awful." So I'm just gonna say that and not actually put it in the chat. All right. Please jump in with questions, comments, raise your hand, come off mute, put it in the chat. I would love just to have this be an open conversation and folks would feel comfortable to jump right in. So that'll be great. So today's agenda, we are going to, again, be covering what it takes to become a community supports provider. What are the expectations by DHCS, by the two Medi-Cal managed care plans in your county? We'll talk about, actually, this is actually based on registration information. When we asked you all, what are your big questions? Most of you said billing. So we're going to be covering billing at a deeper level. There were also some questions around reporting, so we can talk through that as well. And then anything else that comes up, please just feel free to jump right in. And then we're going to do a case study. So looking at what an organization might be thinking about, what are some important questions they should ask. So if you are already a community supports provider, would love your perspective as to kind of the questions maybe you wish you had asked when you were going through the process or that you did ask and were very helpful. So we'll be covering that. And then a lot of you asked also about funding. So we'll talk about some of the funding opportunities available to community-based organizations who are doing ECM and community support. Sound good? And then, of course, questions all the way through. All right. So objectives today, we are doing a 3-part training session for your 2 counties. And we had the first one July 19th, I believe is the exact date. And hopefully with a good level setting presentation. Today, we want to go a little bit deeper and get to know each other a bit more, talk more about the expectations. And again, billing will be a highlight there. And then just spend some more time sharing experiences and hopefully supporting folks who are just thinking about becoming a community supports provider or who are just curious, what the heck is community supports? What is this CalAIM business? Hopefully we can get your questions answered as well. So again, 3 sessions. We had the first one July 19th. I did remember the date correctly. And we can send out that presentation if you have not gotten it already. So if you do have questions, want to go back and review a few things, Carrie can send that slide deck out to you. We're doing today a little bit of a deeper dive, and then the last session for your 2 counties will be in November 10th. And we'll talk about best practices for becoming a community supports provider. And as those of you who are already involved in CalAIM know, things change quickly. So I'm sure there will be new programs and new opportunities to cover in November when we come back together. All right, I'm going to do a quick program overview of our CalAIM Links program. I'm going to go pretty quickly. So if you have questions, all the info is on the slide, so you can certainly refer back to it at a later point in time. But essentially, CalAIM Links is part of the amazing TA that the California Healthcare Foundation is funding around CalAIM. It's a collaboration between HealthBegins, Aurrera Health Group, and Transform Health, where I'm from. And I actually realized I hadn't introduced myself. I'm Gretchen Schroeder from Transform Health. We'll do introductions in a minute. So we're trying to all work together to provide TA around the state. Carlina Hansen is our California Healthcare Foundation point of contact, and she has been instrumental in really getting all of this TA up and running, and we're really grateful for all of the work she's doing around CalAIM for our sessions, as well as through other TA that's being provided. I'm going quickly, sorry guys. Background, so HealthBegins really wanted to do some TA work around the state when CalAIM was being discussed, and they got some funding from the California Healthcare Foundation in 2021. And launched some TA sessions in October, November, December around the state. And we learned a lot. We were all partnering together and learned a lot about what the needs were, the concerns, the anxieties, which I think a lot of us still have around implementing the new CalAIM initiatives. So to continue the work that we did, we took the lessons that we learned and we wanted to do more outreach, more TA. And so the California Healthcare Foundation did fund HealthBegins to do more work. And we have a new program that we've launched in 2022, and we're really focusing on trying to advance equity in CalAIM, trying to build relationships that matter, people in the same county, as well as with TA providers, And then making sure folks know where to get help if they have questions or need TA around specific parts of the CalAIM or contracting process. So really working on that through our 2022 TA sessions. HealthBegins is running 2 tracks for TA. One is going to be a statewide set of sessions that we're doing. And if you haven't done one of those and are new to CalAIM, they're really great at doing the introductions to what this is all about and why it's important. And then we're also doing some TA and county sessions, like in San Joaquin and Stanislaus. We're doing some work in Shasta, Trinity, Fresno, Kings, and Tulare. And so if you have partner organizations in those counties who want some more info, some great things to offer them as well. We also have amazing resources online. There's a whole archive of CalAIM webinars that HealthBegins has done. So feel free to visit the website, and this will be posted there too. But it's a really great way to stay connected with what's happening and have reference materials outside of the DHCS ones, which I'm sure you all have seen. So I want to start by doing some assumptions from our point of view about who is here today, who you guys are, and hopefully how we can support you in your CalAIM journey. So we're assuming that everybody here is a California nonprofit in Stanislaus or San Joaquin or does work in either of those 2 counties. That you are interested in either learning more about CalAIM or you're actively engaged in pursuing a contract, or a few of you may already be contracted. Level of understanding, I would love to say that all of you have done some basic groundwork on CalAIM and have a good understanding, but I know that's not the case because this is a really overwhelming program. So if you have questions, even if they're what does CalAIM stand for type questions, bring them up, let us know, we'll try to answer them. So I did have to look up the CalAIM acronym today because I'd forgotten what it actually meant. So I'm going to be prepared for that question. And then we would love to have you guys fill out the CBO readiness assessment, which has been sent out to you. But if you need it again, the link is in this website. But it's really helpful for us doing the TA to know what your needs are, what concerns you have, how we can better support you as you jump into becoming a provider. So I hope these assumptions are all true. I'm going to test them now to see if they actually are. I want to do some introductions. I would love to have each organization actually have a volunteer come on and say who you are, your name, your organization, what community supports you're either contracting for or thinking about, or if you're just curious, what the heck is community supports? And then if you want to let me know too, what are you thinking about with CalAIM? I know we have billing and reporting, but are there any other questions that you'd like to throw out there today? So I'm going to pick on, who can I pick on? I'm going to pick on Jose Moreno and see if you wouldn't mind being our first guinea pig to come on and do a little quick introduction.
Hello, good afternoon. So yes,
thank you, Jose.
From Medical Concilio, California. And so this, to be honest with you, this is very new to me. The person that was working on this in our organization left. And so right now I'm just kind of curious, trying to get as much information as possible. We do have several programs throughout San Joaquin County where we do help recipients enroll into the Medi-Cal program. We do Medi-Cal outreach. We have a behavioral health center. And so I am familiar in some areas, but not fully familiar. So right now I'm just kind of curious.
Great. Well, I'm glad you're here, and please jump in with questions. So feel free to ask anything that comes to mind.
Thank you.
Great. Can I, Tiffany, would you mind going next?
Good afternoon. I'm Tiffany Rivera from Sierra Vista Child and Family Services, and we are in the process of obtaining a contract for ECM, and I'm just interested in learning more about community supports and hoping to learn something new about that today.
Wonderful. Thank you for coming. Natasha, can I have you jump in here?
Absolutely. And I see that my name is on here twice. So I'm thinking somebody I shared it with. Maybe it's my other personality, not sure, but thinking it might be one of my colleagues that I shared the invite with. So we'll let them introduce themselves since the camera's not on. But I'm Natasha Garcia, Whole Person Care, San Joaquin County. And it's Jenny. Oh, good. And we are currently an ECM provider here in San Joaquin County, but we're also looking at community supports as we try to expand and, how we could get into that space potentially.
Wonderful. Thank you for joining. And does your colleague want to say hello, or is she doing the same type of work that you guys are doing?
I'm not sure, but I will. It's Jenny. Her name is Jenny Malone. She's one of our public health nurses. Oh, she's coming on.
Hi, yeah, I'm
hi, Jenny.
supervising public health nurse here at Public Health, just acting as a support for my dear friend here. So nice to meet you all.
Nice to meet you too. Thanks for joining us. All right, Shiva, do you want to jump in here?
Hi, everyone. My name is Shiva, and I actually just recently joined HealthBegins actually a few days ago. So this is just a new experience for me, and I'm very excited to get to know how everything works and operates, and hopefully contribute in a really productive capacity down the road.
Okay, wonderful. Thanks for joining. Martha, I'm going to say your name wrong. I'm sorry, Manzo or Manzo?
Yeah. Hi. Sorry.
There we are.
Yeah. Okay. Okay. So I'm from Migrant Education Program, and I'm the support service facilitator. So I was curious of what are you guys doing and ready to learn.
Wonderful. Well, I'm glad you're here and ask questions, so please jump in.
Okay.
And then I know we have a lot of folks here who are also part of health plans. So we have both representatives from HealthNet, which is one of the Medi-Cal managed care plans, as well as the health plan of San Joaquin. So Cynthia, do you want to go ahead and introduce yourself real quick?
Sure. Good afternoon, everyone. My name is Cynthia Pena, and I'm the Director of Special Projects at the Health Plan of San Joaquin.
Wonderful. I'm glad you're here. Thanks, Cynthia. And then Melon, do you want to jump in here, or Martha?
Yeah, this is Melon Fu, one of the program managers at HealthNet. And then I'll hand it over to Martha, my colleague.
Hi, everybody. I'm Martha Garrity. I represented HealthNet for 15 years in Stanislaus and San Joaquin with health education. I was on the CalAIM team for about a year, and I'm now in provider relations for San Joaquin Stanislaus County.
Good to see you again, Martha. I saw you in the early CalAIM days, so it's nice to come back here.
Right, thank you.
And then I know, so I am Gretchen Schroeder. I do work for Transform Health, and we are partnering with HealthBegins to do the county TA work, and my colleague Carrie Arnold is also on. And so she's going to be running things behind the scenes. So if you have questions, challenges, just shoot Carrie a chat. And she can get that straightened out. And then I know that we also have Beth Siegel, who is on from the CalAIM Links project too. She's doing the evaluation for all of these TA sessions. So if you see her name there, you will know who she's from. And we just have somebody else joining us. I'm going to give her a minute before I have her introduce herself so she can actually jump on here. But one of the questions that I wanted to ask everybody today before we jump into the actual content is, what are some of the things in the contracting process, if you've already started, that have surprised you so far? Any issues around the payment models that are being offered by the managed care plans? How hard it is to become a managed care or a Medi-Cal provider? What are some of the things that you've encountered that may be good to share with folks who are just learning more about becoming an ECM or CS provider? Everything was normal. Okay, well then let's see what our next question is going to be. Oops, I just went too far. Is there a term that you keep hearing in the CalAIM world that that you don't know what it means, and we can hopefully answer it here? You guys know everything. All right, I may come back to this though, see if we get any more questions as we go through this. All right, let's jump into it. So I know we've covered some of this before, and you may have heard what is community supports 1,000 different times, but I know it takes me several times to learn something. So I wanted to just quickly do a recap of what are community supports, what are we talking about when we're referencing that, so we're all starting from the same page. So community supports are a brand new initiative in California, and I'm very excited about this. We are trying to take the learnings that we got as a state from the whole person care pilots, and Natasha was the whole person care pilot in San Joaquin, and Carrie and I worked on the whole person care pilot in Sacramento. So we have a lot of great background in whole person care. But we're trying to take the learnings that happened in whole person care and the Health Homes program, which both ended in December, that was trying to combine clinical services and social services to really treat the whole person. We're trying to bring those now to the Medi-Cal managed care programs. And so community supports are medically effective, or medically appropriate, cost-effective services that managed care plans can offer, and it's optional for managed care plans to offer these services in lieu of traditional Medi-Cal benefits. So we're trying to figure out what is the best way to treat folks, what is the best way to get them the services they need, and do it in the most cost-effective way. So what's, so if they need housing services, how can we support them in getting those services? They need medically tailored meals, how do we support doing that? So really looking at trying to meet the person where they are and really trying to address the needs of the whole person, not just their clinical needs. So community supports are not Medi-Cal benefits, and that's really important here. They're optional both for the Medi-Cal managed care plan to offer, MCP as we call them for short, and for the member to accept. So that's really, really important. The member does not have to take medically tailored meals if they don't want to. Okay, that's just an option that they can opt into. Under community supports, the managed care plans have been strongly encouraged by the state to contract with local community-based organizations, you guys, to provide these community support services. And why this sounds amazing, and I'm super excited about this, it is really hard because we have been living in different worlds with the Medi-Cal managed care plans over here, and the CBO is really working in a different environment. And so trying to blend these two worlds is a big challenge, and I think we're all aware of it. But I think I'm hopeful that the results of doing that is going to bring great things to our communities and to, I think, to our community-based organizations who opt in. I think there's a real potential here to start to work in different types of partnerships that will hopefully lead to a stronger community network. So I'm excited. I know it's hard, but I'm really excited about the work that's being done. So we are focusing in community supports on addressing combined medical and social determinants of health needs and avoiding higher levels of care, and of course, trying to save some dollars while we're doing that. So that is the goal here. Any questions on community supports? Okay. So providers, as you think about becoming a community supports provider or already planning to become one, I think there's three main areas that we're going to talk about that you need to be aware of, all the different components and the challenges and the benefits that come with that. First and foremost, and what we want to spend some time on today is doing that contract with the Medi-Cal managed care plan. It's a lot of work, and for a lot of community-based organizations, it is completely different language than what we're used to in the grants we get from various other funders. So we want to talk about what does that mean to you? How do you do it? What are the pitfalls? What are the benefits? How do you work it all out? All that good stuff. And then you also need to deliver the community support services. And those may be slightly different in terms of the state definitions and what you're used to doing for HUD or the county or the city where your funding may have come from before. And then you have to do all the reporting and the billing and the claiming. And that is a huge challenge. And we're hearing that around the state. And that is a challenge for CBOs to figure out how to make that work. But these are the three main areas that we are going to focus on today and that community support providers are responsible for. So I try to think about the whole universe of what community support providers need to really understand as they go into contracting. And thankfully, the state has put together, with very boring and dry, standard terms and conditions, which will put you to sleep in about 2 minutes. But there's some really great information in there about what is expected as a community supports provider. And the managed care plans can increase those expectations, but they have to live with what DHCS has really put out there as being a requirement. And so there's several different components, but here are the major ones. And we covered a lot of them in the first session. Again, Carrie can send that out to you all if you missed it. And we can cover questions too if you have that today. But I want to focus on these last two that I have highlighted in green here. But the main components are service delivery expectations. So what does it mean to do medically tailored meals? What are the expectations around that? Is that just meal prep? Is it delivery? Is, what does it entail? The quality and oversight, and this is going to vary probably by managed care plan, but what do the plans expect of you? What documents do you need to do? Do you have to update your policies and procedures? What does that look like for an organization? So that's important, and again, maybe slightly different between the managed care plans, but the state has laid out some good expectations. One of my favorites is data sharing. What does it mean to get data from the Medi-Cal managed care plans? What does it mean to collect the data, store the data, share the data, turn around and bill that data, report that data, all that good stuff? Payments, which is tied into our next section here. Billings and claims, which we'll talk about today. And thanks to all of you who said that was a question that you had. And then I also want to cover a little bit more about what the application process is for each MCP. There are some consistencies between the two plans in terms of what you have to do to apply to become a provider, and there's some slight variations too. So we'll have them cover that when we get to that section. All right, ready to jump in? All right, let's do it. So let's start with the billing and claims. I'm going to give you what the standard terms and conditions say, and then we talk about what it really means for you guys on the ground. And if you're already doing some of these, whether it's for ECM or for community supports, I would love to have you share your experiences and how you've been successful or some of the challenges you're still facing. So what the state says is that community supports providers will be expected to submit claims to the two managed care plans, and in this case, it's the health plan of San Joaquin or HealthNet, using national standards to the greatest extent possible. How many of you guys can do that, do you think? Betting probably none of you guys, because we're not Medi-Cal providers, we're not clinicians, we're not FQHCs. So this is a huge challenge for community-based organizations. So what the state does say is that providers who are unable to do that, and that's the goal, we want to get there, but if we're unable to do it right now, you may instead submit invoices that have, and this is a key phrase here, the minimum necessary data elements that DHCS has laid out. So I want to talk through what those minimum necessary data elements are so we can understand. And the health plans, if you want to jump in here and let us know kind of how you're working on this with providers, that would be really helpful as well, because I know health plans are working really hard to try to support providers as they figure out the claiming and invoicing for community support. But let's jump into these data elements here. So some of these are going to be pretty straightforward. You're like, yeah, I got this, no problem, we're good. And some of them you may be going, what the heck is this? So what the state has laid out is that you must include on your invoice, your claims, your billing provider information. I think that's pretty straightforward. There's also a rendering provider. So if you have someone who is billing separately, they'll have to submit their information as well. We have to have the member's SIN or client identification number. That's going to be really important, and the health plan should be able to provide that for you. It's optional to have the medical record number for the member. So that is something that you can do. And I don't know, how likely that is for you to have that from each of the health plans. And then the member name, again, you should be able to get that from the health plan or from all the forms. There's also a request to have you fill out the member homeless indicator. And there's a lot of information about what that really means and how do you get to that number. I'm not gonna go into that today, but just so you're aware that that's really important. We have to have a residential address. So I'm actually going to call on my Medi-Cal managed care plan members here, or reps here. If we have folks who are experiencing homelessness, how do we deal with a residential address? What are you asking community supports providers to do? Melon or Cynthia, do you want to jump in here?
Yeah, and I think for us, since some of our providers have access to the portal, it would be based off of, how the eligibility is listed for the member. I would
Okay.
say with billing, these are key fields, right, that are provided as part of the claims process, but need to ensure to include things like the codes, the modifiers, and things like that when billing as well.
Okay, great.
Yeah.
Melanie, did you want to say anything here too from
Yeah.
HealthNet?
Yes, that's the same for us as well. It's built into our provider portal. An address, it's not a requirement to receive these services as long as they are an eligible member of the health plan.
Okay, that's good to know. That's great. So I'm going to these are the requirements. It sounds like the health plans have things set up well in their portal. What we do want to get to is the codes and the modifiers. Those are really important. And so how many of you are familiar with the codes for the community support services you're considering billing? So there's some great guidance, and we have it listed here around the codes. And there's different codes and modifiers for each of the community support services, and it's really important that you make sure you're using the correct code and modifier, because that is critical for the managed care plans, and it's critical for the state for the reporting that the managed care plans are doing. So we have to do that. We have to have a start date for the service and an end date. It's optional to have the service name. Again, that code and modifier will really address that issue from the state's perspective. We have to have a service unit count. And so each community support probably has a different type of unit of service. Some may be per diem, some may be per 15 minutes, some may be per meal. So it really depends on what type of service count the managed care plan has identified. You need to identify the place of service. You also need to have the member diagnosis code, a service unit cost, and service charge amounts. And then of course, we want to have an invoice amount. Any questions on what these minimum data elements look like? A few more I'm going to cover, but I want to make sure that if people have questions or like, I have no idea what you're talking about, that we can pause for a minute here. All right, so let's talk about file format, and I may call on our health plan partners as well to talk about what they're doing. So it sounds like that they have a portal set up for folks to bill through, which is really wonderful, and I'm excited to hear that. The state has given folks the option, again, you have to work with your managed care plan to do other types of submissions. So I don't know HealthNet or the health plan of San Joaquin if you guys would accept anything outside of the portal, or if you are requiring all of your contractors to submit through the portal.
So for claims and billing, there's a few different ways that we can accept that. There's, paper claims. Some of the providers may have access to electronic billing as well. So, per those customary ways to submit it, if they have, the capability to do so, that would be great.
Yes.
Wonderful. Thank you, Cynthia.
And for HealthNet, it's the same. We have multiple ways to submit a claims and invoices. We do have a portal, which we use Conduit to submit invoices. And then there's other ways where you can mail in your claims or invoice, and other ways, through Ability and other platforms that could also be sent as well.
Wonderful. I'm happy to hear it. I'm going on a limb here for both of you guys. But what we're hearing around the state too, because this is a challenge for community-based organizations, it's a challenge to get this set up in your organization. It's a challenge to collect the data that's needed to do the invoicing. It's a challenge to do it timely. And what we're hearing around the state is if you have questions, if you're running into a stumbling block, to reach out to the managed care plan you're contracted with and try to troubleshoot with them. I think what we don't want to have happen is have you not submit things and then not get paid for a long time. So I am going to volunteer our Medicare managed care plans here, so I'm hearing this around the state, that if you have questions, reach out, ask questions, get assistance so you can get this done right and start getting paid in a timely manner. So I'm going to just throw that out. And if we have any folks who are already billing for ECM or CS who want to add anything to this conversation, I would love to hear what your experience has been.
I can share just as an ECM provider, which is that we've been doing this now since January and we have yet to bill.
Wow.
Yeah, it's been a bit
not
more
unusual though.
No,
Yeah.
Luckily I'm hearing from other folks that it's kind of the same situation for a lot of people. I think there's been a lot of confusion about, you know, what we've had to go back and forth, and it's not so much on the billing part, it's on the other aspects of what we're doing and what's acceptable and what's not. And then the differences, at least in our county, between our two managed care plans who are represented here. And so the approach is different and some of the requirements are different, you know, like not DHCS directed, but like as far as like diagnosis codes and things like that. And so we have been struggling to align our workflows with what is being given to us, and also trying to do it in a way that two different approaches often. And so that has been what has pretty much held us back from being able to bill. We're hoping to be able to get in our billing by the end of September for the, you know, January through probably August timeframe. Fortunately, it looks like they're going to work on implementing a billing component to our platform, Activate Care, which will hopefully help, but that's going to have its own tricky pieces to it because, again, two different, excuse me, you know, two different plans. One will take it this way, the other one's looking for something else. So it's, again, and it's not to criticize, it's just to say it's been a very, it's been more complex than I think we anticipated. And so we're hoping to get
You are
there.
not alone.
Yeah.
Yeah, no, I think we're hearing this from everybody. So
yeah,
Natasha, do you have any like words of wisdom, things that you've learned now that you wish you started doing back in March? So I know this is a challenge, and you guys, since you went first in January, probably got to work a lot of the kinks out of systems and figure out what the heck to do. So I would love to have you share any best practices that you're developing.
you know, I wish I had some wise words of wisdom that could have some positive help for our partners out there. I don't know, because I think it's a learning process for everybody. So I understand that. It's challenging. And I know I would assume it's challenging for our managed care plan partners. They've been doing their work in a certain scope, right? Where we've been doing things very differently in a whole person care approach. These are not traditional approaches to providing supports and services. And so I think trying to get all of that together and get everyone on the same page as far as what's required on both sides and what has to happen can be a bit difficult. I realize change takes time for all of us. So I don't necessarily, because it just feels like the challenges we've run into have been things that maybe just kind of come up once we're post contract mode. I guess I would say that ideally you have a strong relationship with your managed care plan and open lines of communication, because I think that can be helpful. So start working on the relationships before you go into a contract.
That's good advice. I think that's great advice. I think that sounds like plan early and then get to know your managed care plan really well.
Yeah, exactly. So, and again, this isn't to say, I'm not trying to be like negative here. I'm just trying to, this is the reality of what we're dealing with, and I get it. And we're still having some challenges with some of these things and not sure how we're going to move forward.
And I think that's true, that this is learning for everybody. So it's not anyone doing something wrong. It's really, we're trying to bring together two very different worlds between the managed care plans and CBOs, and the county in this case. And it is hard. It's hard to figure out what language are we speaking? Are we speaking the same one? And then how do we go forward? So
and some of what I've heard from our CBOs is they want to be a community support, but the amount of work and the bandwidth they would need to be able to do it. And as you said, these guidelines and the contracts and the administrative work and everything else, it's just not reasonable for them to be able to do it. So it feels like we're then lacking certain agencies that might be critical because of that. And I've had several ask me to be kind of the in-between. Would I be willing to be a community support provider and subcontract? And I'm not opposed to that. But I'm also thinking about just kind of the effort it has taken just with the ECM, and then to move into a space that we're not as familiar with, and then subcontracting, and how do we oversee that? So I guess I wish there was a bit of an easier path for them.
Yeah.
You know.
Yeah, no, I've talked to a lot of CBOs. Some are hiring, billers specifically for their community supports to really help get that going. And there are some funding options to help support that for, a brief period of time. We'll talk about that at the end. But yeah, I think it's a challenge. And I think this is the one that is really important to go in with eyes wide open, that it's not going to be perhaps as straightforward or as easy as we would like it to be. Anybody else want to jump in, or managed care plans want to jump in? I know we're all learning here, so I want to make sure we get space to learn and share experiences.
This is Martha. I'm going to jump in for a sec because I did work on this side for a while, and what we did was we provided a lot of hand-holding, I think, for some of the agencies that had not really done one of these applications before. And I think that's a really important thing to the community-based organization that might not have the infrastructure, but really wants to provide the services, right? So I think both managed care plans are very open to providing some support in terms of the application process and what it looks like. At least when I was with HealthNet in this team, we did. And that helped us in some of the counties that were more rural attract possible CS provider support agencies, right? And there's also some really good models within the rural areas, especially Yuba Sutter. They have a really strong leadership at the county level, but also they brought in every partner from that small rural county, right? And so San Joaquin and Stanislaus are kind of similar in size, at least with our membership. And there's a lot of models out there. So I just really recommend you talk to Nye Kasich, who is the HealthNet representative, and maybe she can point you also in some directions if you're really interested, but maybe struggling to how to do this. And then there's lots of trainings. Both health plans have a lot of trainings and roundtables. So I just thought I'd share that. And I come from a health education perspective, and it's a very exciting time.
It's exciting and daunting. I think I'm going to phrase those two things, because I want this to succeed, but I know it's a lot of hard work. But I think what you're saying is correct, and Natasha too. Get to know your managed care plan. Get to know that who do you talk to for help and guidance, and there's a lot of resources out there, and making sure we connect you to the right ones. And I think talk to your fellow CBOs. Talk to Natasha. Talk to other folks who are doing this to learn from what they've done, what they may have stumbled on in February. You may not have to go through that as you launch your community supports process. And
I just want to say, Martha, you're right. I mean, there was a lot of support that was provided. Nye and her team provided a ton of support, which was great. And I know they've offered it to our CBOs here as well. So yeah, I mean, I do second that. And I'm not trying to deter anyone from going in it, just eyes wide open.
Yes,
definitely.
No, wonderful. Anyone else want to jump in here? All right. So we have a lot of guidance we're going to put in the slides and reference. So if you have more questions, you want to think more about that, there's definitely a lot of state guidance, and then the managed care plans, I think, do a really good job of offering TA and working with folks to get the billing done. But it is, from what we've seen around the state from most CBOs, it's been a challenge to figure this out. So just, yeah, be aware that it's going to take some time and effort to do that. All right, well, you've met our health plan contacts, so we already did that. I'm going to actually just move right along, but they're here, and they're both great, and I do want to encourage you all to get to know them as you go through the process. That's a really key relationship. Next, we're going to jump into the certification process of what do you do to even become a community supports provider. And I'm going to have the plans each give a very brief overview of what their process is. Again, there's a lot of DHCS requirements, and then there's some managed care plan specific requirements of kind of what that process looks like as you start to become that community supports provider. So Melon, do you want to jump in here with the HealthNet quick overview?
Yeah, so quickly, if you are interested in becoming a community supports provider, as Martha mentioned, we have a community engagement team. The email was shared previously through NIE. They would be working directly with you, really helping you through this entire process. Some of the requirements for certification process is there is a certification application that you will be required to complete on behalf of HealthNet. And so, once that certification is completed, you will submit that to our regional teams, and the regional teams, we do have a certification process review. We are looking for all of our community supports providers to be able to provide policies and procedures, which can be worked through our community engagement team. They will help you through the process because these are all requirements by the Department of Healthcare Services. We're also looking at your capacity, your staffing in the area, and being able to support or help members in your county. And so those are the main items that we are looking for, is making sure that you have that capacity in your county. And so, like I said, it's really working with your local community engagement teams to really put that certification application together, submitting it, going through that review process, and then there will be a notification from us on the award process. Hopefully that covers it.
Wonderful.
Gretchen.
Yeah, that's great. And we're going to cover the NPI in a few minutes. So that's going to be on the slides here. But thank you, Melon. Cynthia, do you want to jump in and add what may be a little bit different for Health Plan of San Joaquin?
Sure. So, in the new provider onboarding process, we do have discussions with potential providers, have them, we meet with them, have them provide an overview of their organizations and their programs. And if it's, a good fit, we do move on to the next steps in the pre-contractual work, which would be an application through our compliance team. And it includes a lot of, core documents like the NPI or evidence of insurance and things like that. And then once that's completed, it's reviewed by our compliance team, our credentialing team, and then we move forward in the next steps on contracting. And then, the onboarding process with our provider services team as well.
Wonderful. And I really appreciate both of you talking about your different process. So I'm going to now take us into what is required by the state. And this has been a fun one. The NPI, which is required to become a community supports provider, regardless of the health plan you're contracting with. This is very new for CBOs. So I just want to spend a few minutes going over it. There's a lot of great guidance out there. We have a lot of links in here with step-by-step guides, but this is really an important piece that CBOs need to know about and need to know how to do. So an NPI is a National Provider Identifier, and it's assigned to healthcare providers or community supports providers by the Federal Centers for Medicare and Medicaid Services. So this is really an important thing to do. It's used for all electronic claim transactions for billing. And community supports, even if you're not considered or you don't consider yourself a healthcare provider, you must have this to do community support. So that's an important thing to do. It does not take a long time to do. It's not too demanding, but it is just something new. And I think for a lot of CBOs that I've been working with, it's kind of assembly and block early on. So I want to make sure we know how to get over this one, and we'll share these resources with you. For community supports providers, typically you need to have an NPI for your organization. Typically, it's not for each member of your organization who's working with the client. There are some exceptions to that, but again, great guidance out there. I'll let you read through as you do it. If you already have an NPI, you don't need to reapply as you're doing your community supports contract. You can do it online or by mail. It takes probably about a half hour to fill out all of the paperwork for it. And there's a really great step-by-step guide here. You'll get this PowerPoint, and it's a really great link to use as you go about doing this. So if you have questions on this guide is amazing. Use that, and then I think your health plans can also provide you some assistance if you still are stuck after looking at the state's guidance. Any questions on the NPI? Okay, now it's time for our case study. So one thing that I thought might be helpful is if we look at an organization, one that I've made up, of course, and just kind of talk through if they're thinking about becoming a community supports provider, what do they need to think about before jumping in and signing the dotted line. So we're just going to talk through it. So we have created a housing first housing provider. And they want to apply for the 3 primary housing services, which are housing transition navigation, housing tenancy and sustaining services, and housing deposits. They think this fits really well with their mission and values and the work they already do, but they have never contracted with a managed care plan before. They've typically gotten their funding from HUD or the county or the city. So they're trying to figure out what questions they need to ask before they jump into the contract process here. They've attended a lot of webinars. They've gone to the DHCS webinars, the CalAIM Links webinars. They've gone to some roundtables in their county, and they really want to jump into this. They just need to figure out how it's going to impact their organization. So I want to ask all of you, and some of you have experience, some of you may just be thinking about this, but what are some of the key questions Housing First should consider before they jump into contracting? Well, I'll start. No one's jumping in here. I think about money. That's where I go to. So I want to know, what is the payment model that's being offered for each of these community supports? Is it the same payment model for all 3? Are there different ones? I want to know, what does that look like? And then once I find that out, and again, each managed care plan may have a slightly different one. I don't know. They may not. But it's important to find that out. How does that model impact my current budget? So if I'm being paid on a per diem basis, for example, for housing navigation, what does that mean for my budget? What does a per diem even look like? How does that, oh, and then again, I think we want to ask you for ideas here before I share all my secrets. What else would you want to know? Martha, I'm going to call on you, Martha Garrity. I know you've worked with a lot of providers as they've jumped into this. What are some of the questions you've gotten over the years, or over the year that we've been working on this? Oh, I call on her and I think she dropped. I'm so sorry. Melon, do you have any insight into what are some of the questions you think providers should be considering as they jump into community support?
Let me think about that, Gretchen. As we're reviewing applications, there's been several questions that have come up. It's definitely around the the payment model, we definitely want to make sure that there's our providers have asked questions about, payment. Will that cover their staffing? How does that, what's the turnaround time for payment specifically, and making sure that, there's that continuous income coming into the organization. For housing, especially for housing deposit, right? We are still working through some of the concerns that are coming in from community-based organization or organizations that will be offering housing deposit, because funds has to go out ahead of time for housing deposit, and how long does that take for us to then reimburse the community-based organization. And so we are working through some of those concerns and questions that have been coming through. And so, those have been some of the major points, is really around receiving funds and how soon the turnaround is. And if providers have to have some funds ahead of time to really be able to pay for these services up front. And so those have been a huge concern. But as I said, we are working through some of those details internally and seeing what's the best route for us to really better support our community-based organizations. So it ahead of time, especially when it comes to funding.
Thank you for sharing that. I think that's a really important point for housing providers. So there could be different payment models. I'm hearing this. I know housing deposits are their own special challenge, but there could be different payment models if you're an organization doing all three of these services that you would need to be aware of and figure out how to budget for. So that's a really, really important thing to learn before you jump into contracting. What I often think about too is staffing models. So what does the state say? What does the managed care plan say about what is my staff to client ratio? What can my staff handle? Because your ratio may be lower than what the managed care plan is requiring too. So what does that look like? And does my staffing model need to change based on what the payment model is? If I'm being paid on a per diem basis, what does that look like for my staff? How does that impact the current model that we use to do our housing navigation in this case? So I think it's good. Understand what the MCP requires. What is the state layout? How does all of this come together to impact my budget? And there's a lot of great tools out there. I know there's some for housing. I'm sure there's some for other community supports providers too, to help you work on developing that budget. So once you know what the payment model is from the managed care plan, how do you build a budget? And I think that's a great thing to really think through. The other question that we often hear is CBOs want to know, how many individuals will I be serving at any given time? What do I start with? What is my max capacity? And so I think that's an important conversation to have within your organization. What can you handle? What does your growth rate look like? It's important to talk to your managed care plan so you understand what their expectations are too. So I think this is really important. So if you start out with only having, I'm just going to pretend here, 5 individuals your first month, what does that look like for your staffing model, for your budget? How do you build off of that? If you start off with 50, what does that look like for your staffing model, for your budget? So I think trying to understand how these different potential numbers could impact your organization is important. My understanding here, and Cynthia and Melon jump in here, but is that it's really hard for the managed care plans to predict what the capacity, or what the panel numbers will be like at any given time. So a lot of this is just working together to really figure it out as a community. So I think it's important to just think through for your organization, what does it look like if I have 5 people versus 50? How can I work with that number? Cynthia, do you have any questions that have come up as you've worked with CBOs on community supports?
Definitely a lot of questions around the billing. So you are correct. There are different frequencies for each one of the 3 housing services up at top. Something else to consider is that there's different restrictions. So there's some services that are like once in a lifetime benefits. So that's something else to consider. And then really for providers to get acclimated with the codes, I know that's a common question. What will the referral process look like for community supports? you know, because for a lot of CBOs, gaining access to the provider portal is something new, and really understanding how that's going to happen. So I would say those are the common questions that come up.
Wonderful. And Cynthia, do you want to say a little bit more about the referral systems? I can see if I'm a CBO, is that me referring clients into community supports, or is that the managed care plan referring clients to me for community support services?
So it could be both, right? But the majority of the time, it would be the referrals that come in. There's a no wrong door policy for the referrals, so they can come from other providers to the managed care plan, which then sends it over to the community support provider. The community support provider could also initiate those referrals, so it's bidirectional.
That's great. And that's really important. That ties into our bottom point here, like how many folks do we have? So, you know, we want to make sure folks understand the process for community supports and who's eligible to receive them, for sure. All right, so now I'm going to go to my next slide here. How do you pay for all this? Like this is huge. Even just the billing system as we're talking, it's like, how do we figure out what we need to do to submit appropriate invoices? How do we make sure we update our organization's policies and procedures? What data systems do we need to have in place to collect, store, manage, share data for community supports? How do we train our staff? All of this costs money. So if I were thinking about being a community supports provider, I'd want to know, how am I going to pay for all of this? Anybody else have that question? Let's talk about how we're going to pay for it, because that just leads into our next subject here, which is the CalAIM funding opportunities. And I really want to spend some time on this. I think it's really important to understand as you're thinking about becoming a community supports provider, there are costs that you will incur just to get started. And there are some mechanisms in place to help with those costs. So let's talk through what that looks like, what the requirements are, the timelines for them, so you can start to think about that and incorporate that into your thinking and probably your investigation too. So there's two primary funding opportunities I want to talk about here today. One is called IPP. It's an incentive payment program. So we'll talk through that, what that looks like. And the other one is called PATH Cited. And I'll go through the acronyms when we get there. But these are the two primary ones that I believe ECM and community supports providers are really eligible to receive to help with some of these costs. So let me jump into IPP first. So we all know, and the state knows too, that launching ECM and community supports is going to require a lot of investment, not just in figuring out how CBOs can build managed care plans, but how do we do all of the work that is needed to really integrate these two different systems, these two different models of care that we've been working off of, the social services and the clinical. So we want to make sure that we're investing in building the bridges between these two. So one of the ways that the state is trying to address this is through the incentive payment program, and it's called IPP for short. And how it's been set up is the state has given the managed care plans incentive dollars to help with their launch of ECM and CS. So managed care plans, when they started doing this, they had to develop what's called the gaps and needs filling plans. So to identify what are the needs in each county to help launch ECM and CS, how do we fill the gaps that we've identified? And so the state wants to give them money to do just that. And so a lot of the managed care plans are using the IPP funds to give out grants or funding to CBOs to help with that. And there's a whole application process, and we'll talk about that in a minute, but it's really trying to identify the gaps and needs of the plans identified and filling those gaps and needs through these IPP dollars. The state has allocated funds by county and by managed care plan. And each managed care plan has a slightly different process and timeline for getting those IPP funds out in the community. This funding, the first batch of funds just came out to the managed care plans at the end of April, and they will continue through 2024. But the key here for the managed care plans, and it's important for all of us to be aware of this too, is the managed care plans have to show progress against filling the gaps they've identified to draw down more funding. So there's a lot of work that needs to be done with the managed care plans and the CBOs to really draw down the maximum funding possible for each county. So these incentive funds, again, are given to the managed care plans, who can then choose to invest them in data systems for the community. They can choose to invest them with CBO grants. It really depends on the MCP and how they want to approach doing this. So we've seen all different ways of doing this throughout the state. It's really exciting. And I'm just really grateful. I think the managed care plans are really making an effort to get these dollars out and do it in a very thoughtful and deliberate way. So the key components for IPP funding from the state, we want to build appropriate and sustainable capacity and capabilities in our communities. What does that mean? It could mean different things in different communities, right? Every county has their own strengths and they have their own gaps. And so trying to figure out how do we fill those gaps is going to be what these IPP funds can do. We're trying to drive managed care plan investments and the delivery system infrastructure, we being the state. We're trying to bridge current silos across physical and behavioral healthcare service delivery. We know there's some gaps there, so we're trying to bridge those two sectors. The state also is trying to reduce health disparities and promote health equity through these IPP funds. State wants to achieve improvements in quality performance, and they want to incentivize the take-up of community supports. It's really important to the state to see these. There's 14 approved community support services. The state wants to see all 14 of those active and live throughout the state. So this is the IPP program in a nutshell. It's very exciting. It's daunting as well. There's a lot of money coming down and very, very tight timelines. So it's a challenge for all of our communities to figure out what to do with all of this. And the managed care plans are, how do we spend these funds effectively? How do we spend these funds responsibly? So I think there's a lot of conversations going on around the state for this. Key components for this first year of IPP funding, delivery system infrastructure. The state wants to have the plans invest in that. That can mean investing in a community CIE, the county's running it, can mean doing a data management system for a CBO. So that can be a lot of different things. Trying to build provider capacity for our ECM services. That's going to be really important to the state as well in this first year. Same for community supports. We want to make sure those community supports are launched and they are being used across the state. And then of course, quality is a really important concern here. So looking at how do we drive quality. Again, every health plan, excuse me, has a different timeline and a different process for the IPP funds. So it's really important to know if you are contracted or contracting, process of doing that, with a managed care plan, to know what the timeline is for their IPP funding. So unfortunately, the state had this really ambitious timeline they threw out there at the end of last year, and they have been delayed getting funds out to the managed care plans, which has just delayed everything. So it's a real challenge right now for the managed care plans to actually get these dollars out the door. So I just want to make sure that we're aware of the pressure that they're under too, to get these out and then to get the reporting done for the state on all of this. But for HealthNet, the payment one application window has closed. They have reviewed the applications and funds will be dispersed very soon. Another round of IPP funding for them will be done in 2022, and they will let you guys know when that takes place. One of the requirements that most health plans have is that you have to be either a contracted ECM community supports provider or in the process of contracting to receive IPP funds. So just be aware of that. And Melanie, if you want to jump in and add anything more here, let me know.
No, you've covered it. Thank you, Gretchen.
Okay, great. So now we'll go to the health plan of San Joaquin. And again, Cynthia, jump in here. Payment one applications are currently being reviewed and funding will come out over the next few months. And then the next payment round for them is looking like early 2023 or in that first quarter of the year. So again, different timelines, probably different applications and process for doing this, but both managed care plans do have IPP dollars.
Sure, and I'll just jump in. So yes, we are in the process of issuing our first payment, and there is going to be a second payment issued shortly after DHCS disperses this year, which we know is going to be in December. And so that's really for calendar year 22. Something to consider is that there will be future opportunities in subsequent payment years. So even though, this year is wrapping up, there will be future opportunities for other providers as well.
Wonderful, thank you, and that's important. Not just this year, it goes on through 2024. All right, questions on IPP? Right, I am seeing none, so I am going to then move on to our second funding opportunity for CBOs. And it has the longest name ever. It is through a separate funding stream. It's called PATH Cited, or PATH Capacity and Infrastructure Transition, Expansion and Development Initiative. I'm going to call it PATH Cited from now on. These are funds that actually do not go to the managed care plans. They go directly to counties, to tribes, to CBOs, to hospitals. So it is different than IPP. It is going straight to the providers in the communities. However, the state really wants folks who are applying for cited funds to coordinate with the managed care plans. What we don't want to have happen with IPP and cited is to have this, to have a duplication of funding. We want to make sure that we're not funding the same thing with these two funding streams. So really focusing on coordination with the managed care plans, with other providers in the county to ensure non-duplication and addressing the needs that are out there. So cited funds are allocated by county. Unfortunately, the state has not released what the final dollar amount is by county. So we don't know what the maximum amount is that either Stanislaus or San Joaquin can receive. This funding window goes through 2025, so has a little bit longer than the IPP funds. And some of these cited goals are very similar to IPP and some differ in significant ways. But I think the key components here are that the state really wants to increase provider workforce. So we want to make sure you're hiring the staff you need. So as we talked about some of the startup costs you may have, you may be able to get funding through cited to pay for a biller to help you set up your billing system, for example, or to set, to get training for your staff. So all of that could be funded through cited. So we want to make sure that we, increase provider workforce, and they do pay for staff costs for new positions or for existing staff that take on new duties. So just be aware of that. And there's a lot of great detail about what that looks like. And I believe they fund staff costs up to 18 months. So, it's not guaranteed that you would get all 18 months worth of funding if you did request it. The state is really wanting to make sure that you have the systems in place to be able to bill and to do the referrals into the program or to receive referrals, that you can share data. They want to make sure that you do that. And so they are willing to put money into that process. And this is about buying systems, about investing in existing systems, training staff to use these systems. So again, if you are thinking that you need to do some more work or get the new data management system to do community supports, there is money available, probably both through IPP and cited to do that. Different timelines, but they can help with that. And then they also know there's a lot of upfront costs that go into doing community supports. So they want to help fund that capacity and infrastructure building. So think about what that means. There's some great examples on the DHCS website, but they want to help fund those. So if you were contemplating that you need, tablets, for example, for your team to go out and work with folks in community supports, that may be able to be funded through cited. So evaluating and monitoring the community support service capacity. Do we have enough providers? Do we need to develop some more? What are the gaps that we have in the community to provide these services? There's funding for that as well. So it could be doing a community needs assessment, for example. What are the needs out there? How do we address them? There's money cited for that. And then I think really important is they want to make sure that we're reaching the folks who could benefit from these services. So there's funding to help develop a plan for outreach services, especially the underserved population. So if you are serving that population and you want to make sure they can access ECM and CS, you know, you could get that funded through cited here. So just be aware. And then there's this huge other category. And I was on a webinar with the state a couple of days ago, and I think the state is really open to things that you think need to be funded to successfully implement, there we go, community support. So I think don't be shy of talking to the state, of calling them up and figuring out, hey, I think I need to have this in my community to really be a good community supports provider. They may be open to funding that. So this other category I think is kind of fun to think about, what else could we do? Cited applications. So the first round of cited applications is open now. The application opened August 1st. It closes September 30th. You do have to be a contracted ECM or community supports provider or be in the process of contracting. So just do be aware of that. They're going to open, I think, application windows. I heard them say, the state say recently, probably every 4 months, but at a minimum of semi-annually through 2025. And you can apply in multiple windows. So keep that in mind too. And we also know that if you apply and do not receive funding, that you can apply for the same thing in the next window. So they're just really trying to figure out how to meet the needs of communities. For those entities in San Joaquin who did launch January 1st, there is cited funding that goes back to January 1st and retroactive funding for the same categories that we just listed. So a lot of great opportunity here to hopefully cover some of the costs you incurred early on, as well as cover future costs. Questions on cited? All right, none. We'll move on. So now we're going to jump into 2 quick polls. We're actually going to launch at the same time here. And this is really to help us make sure that we are reaching our target audience here, you guys. So if you could take a few minutes and just fill out this poll for us, that'd be really helpful. The first poll is around which historically marginalized populations or underserved communities you may be serving or that you plan to serve. So if you could check that off, that would be great. And then we also want to make sure that we find out what is most helpful to you in these sessions. So we have a few pretty basic categories here. If you could fill out for us what is most helpful, that would be wonderful. And I'm going to look to Carrie to launch that poll, and we'll give you a little bit of time to fill that out. Okay, we'll give a little bit more time and you can let me know when we have folks responding. That'd be great.
It looks like we still need some more participants. Okay, we have 1 person so far. Thank you. Oh, perfect. 2. Give another minute. All right, we'll give 10 more seconds, then I'll end the poll. All right, I'm going to share the results.
All right, thank you. So I'm not going to go too much on this because we'll probably use this to help inform future sessions, but I really appreciate the time you guys took to fill that out. And then I am going to jump into, we do have a post-event survey that we would love to get your feedback on. And if you could put down what topics you'd like to see in November, that'd be really helpful for us. We want to make sure that we're meeting your needs. So knowing what your needs are would be great. So I think Carrie will post that again in the chat. That'll be really helpful. And Carrie, you're already ahead of me. Thank you. And then I want to get some space for final questions or comments or thoughts or, oh, there is that term I keep hearing that I have no idea what it means. So please, I'm going to open it up. Just come off mute and we can answer any questions you may have. And Carrie, if I'm missing any in the chat, let me know.
No, there were just a couple requests, material requests that I had received.
Great.
So we will be disseminating that, and it will also be posted too, right, Gretchen?
Yeah, so we'll get an email out to everybody. So wonderful. Well, if nobody has any questions, we will give you back 10 minutes of your day. But I really appreciate everybody coming here today. It was really, it was great to see those of you who came on camera. Thank you. And I appreciate all of the participation from our health plan, Cynthia and Mellon. Thank you very much. And we will see you in November. Thank you all.
Thanks, everyone.